good morning, good afternoon, good evening, wherever you're at in the part of the world. My name is Tolu Olaniyan, and I am a registered nurse and also the CEO of Pretola Global Health and consulting based in the United Kingdom. We're here to talk about epilepsy in Cameroon and how epilepsy affects people in Cameroon, and how a wonderful Dr. Mundih and our team are, supporting people with epilepsy in our country. Today, I've got Torie Robinson and Dr. Mundih here with me, and I'll ask them to introduce themselves to us. Torie?
So yeah, hi again, everybody. My name is Torie Robinson. I'm also based in the UK, but based in London. I'm actually a person with epilepsy who's had a temporal lobe resection, piece of my dodgy brain removed. And I'm founder of Epilepsy Sparks. I'm a blogger, podcaster, etc., all about epilepsy and psychiatric comorbidities and spreading not just awareness, but around the world about epilepsy, but also trying to get people to see it from the angle that, wow, it is so interesting. And actually it can bring people together, well, as you will see, from different nations, and we can achieve so much more together. And that is one of our key goals. Thank you.
Hi, everyone. My name's Mundih Njohjam. I'm a medical doctor working in Cameroon. I'm also the CEO and founder of a non-for-profit organization called Epilepsy Awareness and Aid Foundation, which has as a main objective to raise awareness and educate the public on epilepsy, and also to help people living with epilepsy to have access to high quality epilepsy care. So thank you so much for having me today.
Thank you. Thank you for coming. It's a privilege for us to have you here, telling us about what's going on in Cameroon. And my first question will be for you to tell us a little bit more about yourself, because I've seen you on social media doing a bit of work. So do tell us about yourself and how you go into the space of epilepsy, in doing epilepsy, and a little bit more about your organization and how you do what you do.
Okay, thank you. So I'm a social activist for epilepsy. I also advocate for epilepsy. In 2018, when I was carrying out the research for my MD thesis, my attention was drawn to the burden caused by epilepsy in Cameroon. In fact, in one of the villages where I carried out my study, we had like a case of epilepsy in every home that we visited. And sadly, one of the villages had been stigmatized to the point where it was being called the epilepsy village or epilepsy settlement. Yes, and so the inhabitants of that community, they will even tell me that they can never step their feet in that village because if they do, they are going to have epilepsy, which was not really true. Others will tell me that they will never stare or look at a girl coming from that village because like every girl from that village has epilepsy. So all these observations and findings really prompted me it left a burden in my heart and prompted me to look for ways to mitigate this impact. And when I left that village, I decided to read more on epilepsy. And I discovered that Cameroon had one of the highest epilepsy prevalence in the world. In fact, between 1988 and 2003, Cameroon had the highest epilepsy prevalence in Africa and the world. And I still believe that statistic is still true today. In the region where I currently work, we have so many cases of epilepsy. So my foundation, I started this foundation in 2018 after my study, after my research for my MD thesis. So with this foundation, we aim to raise awareness and educate the public on epilepsy, especially concerning the myths and misconceptions which are so common in our context. For example, people believe here that when you come in contact with the foam that is coming out from the mouth of somebody who is convulsing, you're going to have epilepsy. Others believe that if you get married to a woman who has epilepsy, you're going to have epilepsy. And some of the disheartening things I've also come to encounter during my during this awareness raising is the fact that many women with epilepsy are single parents. And when I question them, they'll tell me that men come to them, they'll ask them, they'll tell them, they'll promise them marriage. And then subsequently, when they sleep with them, they get them impregnated, they are abandoned. So with all this, my organization seeks to educate the public and raise awareness about epilepsy so as to mitigate this impact. We also seek to help people living with epilepsy to have access to quality care, which is really lacking in our context. And this is due to the critical shortage of personnel with training in epilepsy.
So, wow. Just like, I think you can see Tolu and I just like shaking our heads going, oh my goodness. And I'm just thinking, yeah, it's good. Yeah, look, speechless, and that is rare. So it's just absolutely wonderful what you're doing and so utterly heartwarming. So thank you. And you've kind of answered the question that I was going to ask, like, what are the epilepsy issues in your country? But I think you seem to have summarized it very well. And there's no doubt that things go a lot deeper than that. And there are a lot of other things that need to be looked into. So how do you feel, though, that you are going to get funding to help more people affected by epilepsy? And when I say affected, I don't mean just the people with the diagnosis, but also carers and also families and stuff, because we know that the impact of epilepsy doesn't just affect the people with the diagnosis. So how are you going to get the funding that you need, both for research, for treatments, and for raising awareness and understanding? Because if you just do this all on your own, it's exhausting, right? How are you getting funding for this?
Yeah, I think one of the challenges of epilepsy care in Cameroon is the lack of funding. In fact, the government rarely funds epilepsy project. I've not heard of any project, any large-scale project that has been funded by the government. And so anybody that wants to carry out any initiative or any project in epilepsy is compelled maybe to apply for funding elsewhere or use their personal maybe income. And that's what I've been doing, to raise awareness, maybe to create flyers. I have to use my own personal income, because when you want to talk about epilepsy, nobody gives you an ear. It's like epilepsy is really a neglected public health problem in our context. So what we are doing together with my team, we are carrying out studies on epilepsy. And with the results of those studies, we want to use the results and maybe apply for funding. For example, I'm the principal investigator of a study that is funded by the Royal Society of Tropical Medicine and Hygiene. And the study seeks to assess the impact of epilepsy on the quality of life of patients living with epilepsy in communities with high epilepsy prevalence. So with the results, I intend to apply for funding, maybe to carry out other projects that will mitigate the impact. And I also intend to lobby the government, maybe for more money, if possible.
Well, count us in. We're behind you on that. That is what we need. Thank you so much.
Yeah, well done. I love the direction, because we need the data. We need the information.
Absolutely.
We know that there's a high prevalence of epilepsy in Cameroon and in other similar countries. But where's the information? Where the data? What the statistics never lie.
With clean data. This is the current situation, and like you said, they don't lie. It's black and white data. Sort it out. Sort out this issue.
So I love that angle of things, and also I'm aware that you're forming a form of partnership, or you formed a form of partnership with Rowe Foundation. They're supporting your clinics with regards to getting some medication, isn't it?
Yes, that's absolutely true. So we entered into partnership, where the institution where I work entered into partnership with Rowe Foundation And through this partnership, Raw Foundation will be sending the regular supply of levetiracetam, which is a very effective anti-epileptic drug, but which is not available in Cameroon, unfortunately. So patients will be benefiting from this drug. They will receive the drug free of charge.
Thank you. And I would like to say a big thank you to Raw Foundation, because we know that they're doing a lot, reaching out to different countries and supplying medications for free. And this is, at this point, we're going to have to call out the other, pharmaceutical companies, the big ones, the UCBs. We've got UCB, we've got other
GSK, yeah, all these big pharma who have got the funds to help us here,
And then we really need their help. And I can tell you that when the first consignment arrived, we had so many patients that really met the criteria, but yet we could not put all of them on the medication because the quantity, we received 48 bottles. So the number of patients that we have is more than the quantity that we receive. So we are really calling on other pharmaceutical companies if they can help us, because this drug, another drug like lamotrigine, is also very effective, but it's available in Cameroon, but it's really expensive. It's really expensive. So most of these patients cannot even afford the phenobarbital that is somehow cheap. Talk less of maybe affording lamotrigine and maybe levetiracetam if maybe other companies bring it into Cameroon. So most of them will not be able to afford it.
Yeah.
And they also need to know that just supplying like one lot of this anti-seizure medication is not enough, because say that your patients have this drug, great, for 2 months. They need it consistently, right?
Yes,
definitely. Otherwise, we are inviting sudden seizures. We are inviting SUDEP. And we are inviting greater expense to the economy, to the government, because of, recovery measures and things like this. So I think supplying this drug to you and to your people with epilepsy, it's a positive thing for everyone, right?
It is.
Yes, definitely.
It's a way forward, but we need it to be consistent. We need it to be sustainable, which is why we need all these big farmers to work together. We've got UCB, we've got Sanofi, we've got Novartis, and we've got GSK. We've got several of them, making an anti-seizure medication. We need you. We need our country.
Absolutely, we need them.
And look what we've achieved with COVID. We've had big pharma come together to a degree, put egos to one side to a degree, and we are saving the lives literally of millions of people long term. And so we can do the same with epilepsy, which affects at least 65 million people in the world, probably more because of the high rates in places like Cameroon. So let's, sort this out. We have data in other countries. We're all of the same species, us humans. This is going to help people everywhere. Let's come together and make a positive difference to such a huge number of people.
Yeah, but to Raw Foundation, we're saying thank you. We appreciate what you do as an organization supporting countries in low middle income countries. We really do appreciate what you do. And actually the EAMC course was also as a result of their support as well. So that, they're doing so much to support us. So we'll say thank you for that. And the next question we'd like to ask is, why did you, because you are on the EAMC course, the International Epilepsy course, that's our Epilepsy Assessment and Management Course. Why did you register for it?
Epilepsy management in Cameroon is challenged by the critical shortage of personnel with training in epilepsy. Doing my research for my thesis, I came across patients that were on medications that were not appropriate for their seizures. I had a young girl, 16 years old, reproductive age, and she was taking valproic acid. The people that were prescribing these drugs had never received any training in epilepsy. I'm sure maybe they saw somewhere that maybe when you have epilepsy, you should prescribe this drug. So they were just prescribing it. They were so many inappropriate prescriptions. So with this, I realized that if I was going to contribute to the improvement of epilepsy care in Cameroon, I would definitely need the skills and the knowledge. And so when I saw this course, the Epilepsy Assessment and Management Course, for me, it was an excellent opportunity to acquire those skills and knowledge. And given that, like during my medical training, I can tell you that I remember having just one course on epilepsy. And that's the same thing for many other medical doctors that maybe did their training in Cameroon. The course on epilepsy is not really integrated into the curriculum for medical studies. So when I saw this opportunity, I decided that I was going to be part of it. So that's the reason why I decided to register for the course.
That's so lovely. And so what do you think you got from it? And how do you think that, I mean, it sounds like you absorbed so much information. So I guess like have people already benefited from it, from what you may have learned?
Definitely. The course has not only enabled me to gain skills and knowledge on epilepsy, but it has also enabled me to grow my network. And yes, I met Mrs. Tolu, and I believe that through this network, I'll be able to contribute effectively to the improvement of epilepsy care and management in Cameroon. The course has really improved my clinical practice. Like I said, I had just one course on epilepsy during my medical training. So when I just came out from medical school and I was working, when I see a patient with epilepsy, I was somehow scared. Like, what if I prescribe the wrong medication? What if this patient comes back complaining that the seizures are not well controlled? What am I going to do? What is the appropriate medication for someone with epilepsy who is pregnant? What is the appropriate medication for a child with epilepsy? So many of these things, many of these issues were really addressed during the course, and it has enabled me to clerk patients and manage patients with epilepsy with more confidence. So I know what to do when a patient comes, maybe for follow-up. I'm supposed to look at, assess the patient's compliance to medication. I'm supposed to check maybe if there are side effects. I'm supposed to evaluate how the patient, maybe the number of seizures that the patient has had the past month. So I've really learned a lot, and I believe the knowledge that I've gained and the skills that I've gained from this course is going to be like a framework for me to build on to pursue further studies in epilepsy, because I am an aspiring neurologist and epileptologist. So this course is really a solid foundation for my career.
That's so lovely to hear. So yeah,
we're carrying you on.
Yeah, totally. And was it at all useful to hear, do you think, about the psychiatric comorbidities, which are so common in people with epilepsy, and indeed how that affects in families as well, and how that interacts with drugs? Because I feel that is rarely looked at by neurologists in general, even in other countries.
Sorry, I didn't get your question.
Sorry, so we touched on, I know I did quite a bit in my session about psychiatric comorbidities of people with epilepsy, which are so very common. And was that of any help to you? Because I think my limited experience, that's something which is not prioritized much for neurologists or GPs when looking at people with epilepsy.
That was very helpful. It was very helpful because I remember encountering cases with epilepsy who had maybe multiple psychiatric comorbidities. In the village where I conducted my studies, I saw youth 19 to 25 years. They were already roaming the street in schizophrenic state. So yes, and nothing was being done to manage that aspect. And it's something that I've also noticed. Most often when these patients, they come to the hospital, the consultant or the physician will only focus on the seizure. They will not really ask them, maybe questions to know if there are other psychiatric comorbidities that are developing, is a person depressed, is a person anxious, all those things. So the course was really helpful.
That's great, yeah, because we know that those psychiatric issues can often cause seizures, and then you're stuck in that circle. And so you have, thank you. Sorry, Tolu, you were going to ask something.
It's great to see the confidence,
yes,
you know, and I love the fact that you said that you feel more confident being able to support people with epilepsy. And actually it was very evident in the course because you answered questions, you asked questions, you engaged well on the course. I love the fact that I think it was when we had the pediatric session with Dr. Sandia from Belfast. You engaged well, actually, in a lot of the sessions. So well done. And I'm glad to see that translates in your practice. Yes, we'll be doing a bit of more work together because we're engaging Kim Morley to see how we can use the women's, what's it called now? Risk assessment, the women's assessment tool, you know, maternity assessment tool in Cameroon to see how we can use that to improve care with you going forward, even when the course is over. So we will be doing some work with you afterward, but well done for all you do. So lastly, I'd like to ask, how can people contact you? Tell us, give us your social media handles and tell us how people can contact you. And also people from Cameroon that would watch this, you know, people globally that watch this and go, oh, I've got a relative in Cameroon, they've got epilepsy. How can they reach out to you?
Oh, okay, so they can either contact me through my different social media handles. On Instagram, it's epilepsy_awareness_and 8_foundation. Foundation is abbreviated as FDCN. So on the Facebook, it's just Epilepsy Awareness and 8
Don't worry.
Don't do that.
Yeah. But your social media handles are okay, and we'll post that up as well. But thank you for sharing that to us. So thank you for sharing that with the world as well. But well done for all you do. Well done. We are so in awe of what you're doing. Keep up the good work. We're here to support you from afar in whichever way we can. And we'd also like to say one more time to Rowe Foundation, thank you for all you do. Thank you. And it's been a lovely time hearing about your work, and keep it up. And our love to your team back in Cameroon as well. All right.